Hi everyone, and welcome to another installment of Mental Mornings. Today, we'll be taking a look at the fascinating topic of ethics in multiple relationships in psychological practice. Multiple relationships occur when a psychologist holds both a therapeutic and other role with a client. So for example, being a client's psychologist, but also their friend, family, employee, client, and so on. When these roles become blended, the situation can entail risk for the client and for rendering effective psychological services. To explore further, we'll be taking a look at this topic from the following angles. First, Carrie will be taking a look at those multiple relationships that are sexual in nature and entail clear boundary violations. Secondly, Anthony will examine multiple relationships in more complex situations where boundary violations might not be as clear.
Thirdly, Mitchell will explore the nature and ethical implications of multiple relationships in small communities, while John will explain what we should do as psychologists when confronted with a multiple relationship. What you will notice throughout our considerations is that we all put forth the argument that multiple relationships are complex, multifaceted phenomena which exist on a spectrum from potentially highly damaging through to possibly therapeutic and even necessary. Now, over to Carrie.
Anthony. As mentioned, multiple relationships can be on a spectrum, from potentially highly damaging through to possibly therapeutic and sometimes necessary. So at the more severe end of the spectrum is when a psychologist engages in a sexual relationship with a client, a former client, or a close associate of theirs. Now this can involve overt sexual behaviour, but also subtle behaviours like seductive gazing. So it is not illegal for a psychologist to have sex with a client or a former client as long as they're over 18. However, it is a violation of the APS Code of Ethics and requires mandatory notification to APRA. So while the Code of Ethics uses words such as refrain and avoid in standards within the Code, it is highly prescriptive when it comes to the issue of sexual relationships. The Code recognises that the psychologist holds a position of power and trust, and clients are vulnerable when they seek help. This power imbalance has the potential for exploitation. A sexual relationship between a psychologist and a client is a clear boundary violation, which can impair the psychologist's judgment, leading to a lack of objectivity and therefore impair their competency. And for the client, they may start to stop divulging feelings that they may deem to be unattractive. So it can impair therapeutic progress. It may create dependency on the psychologist, and it may trigger new symptoms or exacerbate current symptoms. So this violates numerous sections of the code, namely Standard A.2, which requires respect and for psychologists not to behave in a way that coerces or demeans. There's Standard B.3, which requires psychologists to simply be competent and to prevent harm. Also Standard C.3.1, which in multiple relationships are seen as a conflict of interest, and the associated issues of lack of judgment and bias and competency. But the clearest standard in the code is C4.3, which specifically states that a psychologist will not engage in a sexual relationship with a client or former client or their associate, and with a former client for up to 2 years after therapy's been terminated. And this just recognises that there may be some vulnerability in that time. So an interesting article by Mileski and Kiselika in 2005 suggests that we can look at multiple relationships through a lens of two principles, autonomy and non-maleficence. So autonomy is the power of the client to make their own decisions and choose their own path, and for the psychologist to support that. So is a client in a vulnerable state really able to make an autonomous decision regarding engaging or not engaging in a sexual relationship with their psychologist? For the psychologist, does that relationship then become the primary focus? And does that then encourage dependency rather than autonomy? Will the sexual behaviour cause harm? The issue of non-maleficence, harm now or harm in the future? Sexual activity is universally deemed to be inappropriate between a psychologist and a client, and it's never part of any evidence-based therapeutic treatment. A well-publicised case that you may have heard of involving sexual misconduct was that of a former prison psychologist and one of the Scaff brothers who were convicted of gang rape. The Healthcare Complaints Commission had deemed her conduct to be unsatisfactory, It compromised the client's therapeutic process, and interestingly, it created additional risk for when that client was to be released into the community. So they disqualified her for 3 years. Fortunately, cases like this are rare. Of 641 cases notified to APRA in the 2015-2016 annual report, there were only 5 for sexual misconduct. So we're going to talk more about resolving some of these ethical conflicts a little bit later in the show. But up next on Mental Mornings, we've got Anthony, and he's going to be discussing some more subtle relationships with a little bit more complexity. Stay tuned and we'll be back after the break.
Thanks, Carrie, for helping us to understand the more obvious and clear-cut ethical issues around multiple relationships. But real-world practice is a bit more nuanced and ambiguous than that. The APS considers seemingly minor issues to be of significant importance because they often precede substantial transgressions through the slippery slope process. Now, boundary crossings are deviations from commonly approved practice, which may be harmless or adaptive for the client. However, they can also be harmful and exploitative, depending on the client, the psychologist, and contextual factors. In contrast, boundary violations occur when the psychologist prioritizes themselves over their client, they possess an ulterior motive, or they misuse their power and trust. We can compare these forms, for example, extending your client's session time if they're having a breakdown, as compared to moving your attractive client's sessions to the end of the day so you have more time for them. Now, I'm just receiving a tweet now from my good friend and colleague Dr. Phil, who's asking, how does this relate to the Code of Ethics? Well, it relates to section C.3 of the Code of Ethics, where it says psychologists must refrain from engaging in multiple relationships because they may impair their competence, efficiency, objectivity, or their ability to render this service, and they may harm or exploit their clients. Now, if entering into this relationship is unavoidable, then psychologists right at the beginning have to adhere to the standards regarding informed consent. Now, I'm just receiving another tweet in now from a Natalie Windsor, and she asks, how do these multiple relationships relate to autonomy and non-maleficence? Well, Natalie, you must be one learned individual because you're right on the money. Carrie earlier spoke about how these principles are 2 central ethical principles for multiple relationships, and we need to consider them when we're trying to decide whether an action is a boundary violation or a boundary crossing. Now, for example, seeing an adolescent client in their local youth centre, for example, rather than my hospital clinic, am I enabling him to feel more comfortable to open up and so be more autonomous with his approach to this intervention? Now, I'm just receiving another tweet from a Mr. Darth Vader. He's commanding me to tell him, show me how multiple relationships can be good. Hammond, Lazarus, and Zer all argue that crossing boundaries can be beneficial or even necessary in order to maximize a client's benefit. Often in African and Asian countries, the act of revealing personal information to a stranger is culturally inappropriate. So an increased degree of self-disclosure may be necessary and beneficial for the clients. Now, I've received another tweet. This one's from just from my mum. She's telling me to stop jabbering. So I'll get to the point and look at the advantages and the disadvantages of multiple relationships, and they can actually build stronger rapport. And the psychologist can learn about the client's context and gain information rather than through the one perspective alone. On the other hand, there is the reduced professionalism, potential confusion regarding confidentiality, and the blurring of the psychologist's role. Both Carrie and I, no doubt Mitch and John in the future, will also show multiple relationships are complex, they're multifaceted phenomena which exist on a spectrum from potentially highly damaging through to possibly therapeutic and even necessary. So now this mental morning is going to get a little bit more mental, as Mitchell will explore the role and implications of multiple relationships in small communities.
Let's now take a look at navigating multiple relationships in small community settings. To start off, what is the first setting that pops into mind when you hear the phrase small communities? A common setting that tends to pop up is a rural one, and while rural communities definitely fit the bill in terms of being an example of a small community, now the term has expanded to apply to a situation where the network of individuals is relatively contained and insular. These networks tend to have these characteristics because of their size, and this tends to be associated with the fact that they're operating in some specific domain or context. So this can be because they are geographically isolated, so that's the example of the rural community. They might be based around some specific socio-demographic feature, so you've got deaf communities or communities of color, or they might be based in some other specific domain, so you've got military settings or faith-based settings. It's precisely because of the size and the relatively insular nature of these networks that poses unique challenges for psychologists who serve them. Now that we've established a general picture of what defines a small community, let's consider what it is about this context that poses unique challenges for maintaining clear boundaries and what the implications are for the APS Code of Ethics. To begin, let's have a think about Standard C.3.1, which obliges that psychologists refrain from engaging in multiple relationships. While this standard serves to protect the client and the integrity of the psychological service, strictly adhering to this standard poses problems for practitioners in small community settings. Here, Hellbrook remarks, when working in a rural community, providers are immediately confronted with the reality that they will be interacting with patients outside of the therapeutic frame in a number of contexts. Additionally, psychologists also have to manage relationships between clients and other members of the community. For example, Hellbrook remarks many situations where a client would work closely with a friend of a psychologist, or in other cases, where one of his own children would befriend one of his child clients. Even after therapy, interactions with former clients may be difficult to avoid. What these points serve to highlight is that in a small community, overlapping social circles are all the more likely. Given the likelihood of multiple relationships emerging, an implication of this from an ethical standpoint relates to the issue of confidentiality, Standard A.5.3. For example, Hellbrook references examples from psychologists who might have to work harder to safeguard the confidentiality of a client who might wish to see the psychologist anonymously, for fear of stigma, for example. Psychologists may also inadvertently come across information about clients outside of the therapeutic frame, and also need to make decisions about when and if it is appropriate to bring that into therapeutic sessions. Another area that this has implications for is the area of informed consent, or Standard A.3.3. Here, psychologists need to ensure that clients are aware of the possible risks associated with seeing a psychologist with overlapping social connections. With that said, inevitable multiple relationships aren't always inherently negative. Here, Craig adds that psychologists in small communities are more likely to see the results of their work with clients, and psychologists are more likely to understand the context of the issues that clients bring to treatment. This begs the question, in a context where psychologists are faced with inevitable multiple relationships, what can a psychologist do to avoid an inevitable multiple relationship exposing further areas of concern from an ethical standpoint? Let's now go to John, who will share more.
Thanks, Mitch. So what should you do if you find yourself involved in multiple relationships with a client? There are a number of steps to follow, and it's important to be careful and vigilant. There are risks to the therapist, to the client, and to the therapeutic process. Risk management may appear self-serving, but is required to protect the psychologist from any legal action in the future. I'll go through some recommended steps on how to approach multiple relationships and some questions to keep in mind during the process. Keep in mind that the best interest of the client must be at the forefront of any decision that is made. First stop, refer to your code of ethics. In order to serve the best interest of the client, combine your understanding of this with sound judgment. Look at the situation objectively, take a regulator's or a legal point of view, and also set boundaries before entering into multiple relationships and examine any personal motives there may be. Keep in mind that the therapist-client relationship is not evenly balanced and it places the psychologist in a position of power. Psychologists must use professional judgment in order to maximise their client's autonomy while minimising harm to their client. According to the Code of Ethics, Section B.3, psychologists take responsibility for the reasonably foreseeable consequences of their conduct, take reasonable steps to prevent harm occurring as a result of their conduct, and are personally responsible for professional decisions that they make. Also, the Code of Ethics states that psychologists are committed to the best interests of their clients, the profession and their colleagues. They identify and avoid potential conflicts of interest, and they refrain from exploiting clients and associated parties. From here, obtain informed consent and discuss potential risks and benefits of the dual relationship. As mentioned, the psychologists are in a position of power over the client and they need to explain any issues that may arise in the future. Informed consent is covered in the Code of Ethics Section A.3. Ask yourself, will entering the multiple relationships maintain the best interests of the client or the former client? The Code of Ethics covers this, with general principle B, where psychologists provide psychological services to benefit and not harm. Psychologists seek to protect the interests of the people and the peoples with whom they work, and the welfare of the clients and the public, and the standing of the profession take precedence over the psychologist's self-interest. The Code also states that psychologists do not exploit people with whom they have or had a professional relationship. Ethically, a new relationship cannot undo the work of a previous relationship. In regards to former clients, the psychologist should ask if an equal relationship can exist between two parties, or will the client still depend on the psychologist. Next step is to evaluate potential scenarios and be willing to discuss any unforeseen problems if they arise. Potential risks include conflicts of interest, loss of objectivity, and disruption to the therapeutic alliance. Seek consultation, consult with other professionals to resolve dilemmas, and obtain supervision if the dual relationship becomes problematic. Does the record show adequate evidence of professional consultation? And are the sources of consultation credible? Next step, document. Grab yourself a pen and paper and write down everything in your clinical case notes. This will help the psychologist justify their position if any legal action is taken against them. Ensure that the record reflects a patient-oriented decision-making process. And finally, proceed with caution. Keep best interests of the client at the front of the mind. Consider if there's a personal agenda, and if necessary, refer clients to other professionals. So there's some thoughts to keep in mind if you find yourself entering into a multiple relationship with a client. I'll now throw back to John and Kerry in the studio, and they can wrap up the show. Thanks for listening.
Well, what a fascinating show we've had here today on Mental Mornings, where we've been exploring the ethics of multiple relationships in psychological practice. Firstly, we hope you've got an understanding of how to recognise a multiple relationship and the risks of entering into one. And as we discussed earlier, multiple relationships can be seen on a spectrum, and at one end they can be highly damaging, such as having sexual relationship with a client, which is a clear boundary violation, or as Anthony discussed at the other end, situations may be more subtle and ambiguous, and possibly involve boundary crossings, such as meeting a young client in their own environment to help build rapport, or it might be culturally appropriate to accept a gift from, example, an Asian client, or you might risk offending them. Given the complexity of multiple relationships, it's important to understand the Code of Ethics and associated guidelines, which are there to provide guidance for ethical and professional conduct. And you may find it useful to clarify situations in which a multiple relationship may be an issue through the lens of the principles of autonomy and non-maleficence. Now over to John to wrap up the show.
Oh, thanks, Gary. Mitch explained how multiple relationships can occur in small settings and used the example of a rural community. He demonstrated the challenges that psychologists face in these small communities and that some multiple relationships are unavoidable. However, he also mentioned that some multiple relationships can be beneficial to both parties. I talked about the steps to take if you find yourself facing a multiple relationship with a client. I talked about the importance of keeping the client involved in the decision-making process at all times and to ensure that the progress of the new relationship is documented throughout its development. If you or someone you know is entering into a multiple relationship with a client and need more information on the topic, please visit our website at www.mentalmornings.com.au. Thank you for tuning into Mental Mornings today, and we look forward to your company next time.